that in times of crisis, in times where there's deep concern about the communicability of a disease, that it is the professionals, the Board of Health, the Commissioner of the Department of Health, and all of the professionals that back her up, that make these policy decisions. And so I think I'm very happy as a county executive to defer some of that power because it's the right thing to do. And I know Dr. Ambler will address this, but let's understand what this is not. This is not a debate over vaccinations. This is not the expansion of vaccinations. People who are out there who hold certain philosophical beliefs will interpret any action in this area as being that, but that is not what this does. And I invite anybody to get the actual law that Legislator Williams presented that was voted on unanimously by the board, bipartisanly by the board. Read it, and you'll see very clearly what it does and what it doesn't say.
So what does this new bill do? It basically gives the health department greater ability in preventing disease when outbreaks occur. It allows us to be proactive and not have to wait for the county to declare a state of emergency before that we can take action when we have an emerging infectious disease.
That in times of crisis,
this bill does not mandate or will not mandate that you have an immunization. I want to bring up one other thing, and that is that we are approaching flu season. And flu vaccine, although not related to this bill, I think is a perfect opportunity to And certainly, if we had individuals who had been exposed, we would, in a workplace environment, we would not want others to then carry that on. So what might happen is that we might have an instance where we would have to say to people who were in a work environment, you need to work here until this is under control. You would need to be vaccinated to continue to function in the job that you're in. We get people from all over the world who come here to working in camps over the summer. And some of them come from countries where diseases are rampant and where immunizations are not given. And so if they come in and they've not been vaccinated and they bring their diseases, with them, so to speak, they have the ability to spread disease within this community. But let's just say, for example, if there was an outbreak of hepatitis A, we did not have the authority to say every food handler in the area must be vaccinated. And so sometimes when you get into certain outbreak situations where you have disease and you know that certain people are placing the public at risk, it would at least allow the Board of Health to make a decision regarding that. This bill doesn't dictate anything in regards to immunizations. In this particular restaurant or this particular area where we have known cases of hepatitis A, you must be vaccinated.